Well, Fiona, thank you so much. And I wanted to welcome everyone to this kickoff event for our third annual Migration is Beautiful campaign that's being hosted by the MGH Immigrant Health Coalition. As I think everybody on this Zoom session knows, migration really is the bedrock that has created our country, the United States of America, since our founding, with the exception of those American citizens who are indigenous. Everyone else here is here as a result of immigration and migration, and we all have our family histories to think about and thank our relatives for taking acts, in my case, is incredibly courageous acts to come here to the U.S. and try to create a better life for them and their families. There's no doubt that migration and immigration has enriched this country, and it has certainly enriched our hospital. We have an incredibly diverse set of people who bring a lot of the missions of MGH together, or four activities of care, research, education, and community health. And if it weren't for the diversity and multicultural and multi-country origin of those individuals, this hospital would not be nearly as strong, robust resource for our patients and for our society. One of my favorite quotes from the amazing Broadway play Hamilton is, "Immigrants, we get the job done." And I certainly see that every day play out at Mass General. But I think as we reflect back on our past and current issues with respect to immigrants, I think we also recognize that in this country, each wave of immigration has been faced with resistance, fear, xenophobia, violence, and discrimination. And I think that those issues have been brought into even sharper focus this year with behavior of some people in government, and also the pandemic that we're living through that disproportionately is affecting communities, often which are made up of newly immigrated individuals. So we at the MGH certainly recognize and value the critical role that migration and immigration has played in our success, and we understand the importance of remaining steadfast in our commitment to the care of all patients and all of our staff, regardless of when or where their families arrived here in the U.S. From. It doesn't matter what boat you came on, doesn't matter what plane you came on, or doesn't matter what trail you walked across the border on. We want to be there for you as patients and for our staff. So I want to thank this committee thank this coalition, the MGH Immigration Health Coalition, for helping to spread the message across the community about the importance of immigration. And it's important not only for our staff and patients, but for the communities we serve. And so I want to thank you for all you do to help get this important message across, and including supporting this celebration. So it's my pleasure at this point to turn this Zoom meeting back over to Fiona Danaher, who's a pediatrician at our Chelsea Health Center, is very involved in our child protective team, and is the chair of the MGH Immigrant Health Coalition. So thank you all so much, and I apologize that I have to run to yet another Zoom meeting, but pleased that I could participate at least in the front end of this event. Thank you.
Thank you so much, Dr. Slavin. We really appreciate it. And thank you to everybody who's joined us today to celebrate the Migration is Beautiful campaign. I'm Dr. Fiona Danaher, chair of the MGH Immigrant Health Coalition and director of the new MGH Center for Immigrant Health, which you'll hear more about at the end of today's presentation. The original Migration is Beautiful campaign was launched by artist and activist Fabiana Rodriguez in 2012 as a way to counter anti-immigrant rhetoric and celebrate, in her words, the resiliency, courage, and determination of migrants who come in search of their dreams. The monarch butterfly, which migrates from Mexico to the US, to Canada, and back again each year, knows nothing of borders and has thus become a symbol of migration as a beautiful and natural phenomenon. Unfortunately, anti-immigrant rhetoric and policies have only proliferated in the past several years, and so too has the need to counter them. Perhaps no development has demonstrated this imperative more clearly than the COVID-19 pandemic. And I've lost my Zoom screen, but please go to the, no, perfect, okay. So immigrants are disproportionately represented on the front lines of the fight against COVID-19. Here in Massachusetts, they make up a third of our physician workforce and more than 40% of nursing assistants and home health aides. They're also disproportionately represented in other essential industries, including agriculture and manufacturing, as well as in industries that have taken the hardest financial hits from the COVID-19 pandemic. Yet, due to a relentless onslaught of more than 400 anti-immigrant federal policy changes since 2017, they're less likely to be eligible for relief measures and are more likely to fear accessing them. By deliberately and methodically marginalizing the immigrant population, our government has created a system in which those doing the work that puts them at some of the highest risk of infection also have the least recourse to advocate for safe employment and housing conditions or paid sick leave. We've created a system in which fear of the government translates into fear of participating in contact tracing and accessing needed medical care, including COVID-19 testing and treatment. By perpetuating inequities, we've created a system that is ripe for the virus to exploit. You can go to the next slide, please. Perfect. We saw the consequences play out tragically during the first COVID-19 surge last spring. All of the Massachusetts communities hardest hit by COVID-19 in the first wave had higher than average proportions of foreign-born residents, shown here in yellow. In fact, a recent study in Health Affairs found that in Massachusetts, quote, the proportion of foreign-born non-citizens was the strongest predictor of the burden of COVID-19 cases within a community. Next slide, please. This sad truth was borne out on MGH's COVID-19 inpatient units. Normally, about 9% of our inpatient census has limited English proficiency, but during the first surge, that proportion climbed as high as 65%. As the second surge gets underway, our proportion of COVID-19 inpatients with limited English proficiency has already climbed once again to 30%. For this reason, we are grateful today to hear from a series of experts from medical institutions and community organizations across the greater Boston area to learn how COVID-19 is impacting local immigrant populations and what can be done to turn the tide. In a year of renewed focus on social justice, COVID-19 has taught us once again that the health of our society depends upon the health of its most marginalized members. And with that, I'm pleased to introduce Dr. Joe Betancourt, Vice President and Chief Equity and Inclusion Officer at MGH.
Great, thank you so much, Fiona. I really appreciate the kind invitation. I want to thank all of you for taking time out of your busy schedules to join us. It means a lot, and certainly this is a time that really requires reflection, certainly about where we've been and where we are. So it's an honor and a pleasure to get a chance to humbly share a couple of thoughts with you here, both personal and professional. Again, I'm a practicing internist, primary care doctor at Mass General. I've been here for about 20 years, and I'm originally from Puerto Rico, grew up in New York City, and so I do have in my history an immigration experience with my abuelas and abuelos coming in the late 1950s to New York, working in sweatshops in Midtown Manhattan, working in housekeeping services, opening up a bodega in Spanish Harlem. So clearly, while they didn't have to face the legal issues, given that we as Puerto Ricans have the good fortune of having citizenship, many of the challenges of mistrust, of language barriers, of isolation or discrimination were things that were shared with me, and I got to see firsthand and drive a lot of I think my commitment to what I do and why I do that today. We all have an immigration experience, absent those who are indigenous, and some is by choice and some sadly was forced. And I think it's important that we acknowledge that history as part of where we are and where we're going, especially in relation to the very difficult few years immigrants have had more recently as it relates to how they are treated and mistreated, quite frankly, here in our country in some unprecedented ways. I guess I'll just end this by saying that we, with the COVID pandemic, as Fiona has demonstrated, and again, thanks to her for her incredible leadership throughout this process and really standing up for our immigrant community and this coalition as well, is that yes, we did anticipate in early March that this pandemic would disproportionately impact communities of color. We did to some degree predict the perfect storm that included individuals coming from communities where structural racism had led to segregation, multi-generational housing, densely populated areas, dependence on public transportation before we were telling people to wear masks. And we attempted to stand up a series of efforts that myself and Leslie Aldridge, my colleague, will share with you shortly. But ultimately, those things that we began to see, and the least of which was the very deep worsening of social needs and the social determinants among our communities of color, and worsened among those with mistrust and immigrants for whom concerns around public charge, concerns around access, language barriers, I think made our marginalization of them and our underfunding of public health, I think, critical to why the pandemic has disproportionately impacted them in so many ways, and hopefully provides a global case study for how common sense immigration policies really are essential to the health and well-being of us as a nation. There aren't any lines between the Back Bay and Chelsea. We all are one community, and these viruses don't respect those socioeconomic or kind of legal migration lines. And so I'm proud to say that as part of our efforts, we did create something called the Spanish Language Care Group, where 50 of us Spanish-speaking doctors worked with our surge teams as our COVID patients were disproportionately Latino and Spanish-speaking, 40 to 50% of them at some point. So they always had a Spanish speaker there that's part of the surge team who could bring clinical, linguistic, and cultural competence to that work. We made sure that we had Spanish speakers on our hotlines. We went down and spoke to our most diverse employees in materials management, food and nutrition, environmental services, to give them the information that they couldn't get, that many of us were getting via computer or via Zoom. And we launched an emergency text messaging platform to help give them information to protect them and their families. Was it enough? It's never enough, but we're committed to doing more and more, and not having a short memory, and having the courage to take everything we've learned from this pandemic and really make our healthcare system better for all. So with that, thank you all so much. Fiona, I appreciate the opportunity, and I'm going to pass it over now to Leslie Aldridge, who directs our Center for Community Health Improvement, who could talk as well about our community outreach and engagement efforts, because I'll end by saying that we knew how important it was to take a doorstep to bedside approach to this pandemic, and in the future to everything we do around health and wellness. So thank you.
Great. Thank you, Joe. And thank you everyone for having me here. I'm really humbled to be here and speak. So yes, as Joe said, I'm the executive director at the Center for Community Health Improvement. I've been doing this work for over 20 years now, mostly working in the communities of Revere and Chelsea, leading the Center for Community Health Improvement. I come to this work really with a passion for social justice, as all of us do, I think, and really wanting to be driving equity for patients and our community members. So that is at the heart of what we do, and at the heart of what we do at the center. You know, what we do at the center is to really work to understand the health and the challenges that residents face. We ask residents what's most important health issues to them, and often they do not say diseases like cancer or heart disease or diabetes or what affects them. As we know, those are the leading health issues, but instead people say it's substance use, violence, access to childcare, employment, often brought on by poverty and the structural racism that exists. So one of our first bodies of work, you know, at the center was to develop a community health worker model. We hired staff with lived experience, often immigrants themselves, to help navigate patients to work, to connect to services. And today we have a robust team who work alongside doctors and other providers to help patients connect to needed health and social services, and really lend an ear and help people feel less isolated in their day-to-day experience. And I think that's what this is all about, just connecting. We have staff like Ferdinand Hersey, who came here as a Somali refugee and really wanted to give back. She's now graduated from college. And staff like Tenshin Samuel, who came here as an Ethiopian refugee, and he was seen here at MGH Chelsea Refugee Program. Now he's a community health worker going to nursing school. So this workforce, I believe, really embodies the beauty of migration, and it's a vital workforce that's now being expanded throughout our system. You know, as Fiona has said, in the communities that we are serving, COVID has kind of, you know, wreaked havoc on these communities. And this is really as a result of most of the immigrants in these communities, residents in communities like Chelsea and Revere, who are foreign born, are frontline workers in service industries who've not had the luxury of working from home during this pandemic. These positions often don't pay high wages, as we know, which doesn't allow individuals to pay for housing on their own. So residents double up, triple up in housing, creating a concentration of overcrowding. And these factors, along with, immigrants, as many of you said, being hesitant to receive care because of fear of being deported, just wreak havoc, and COVID spread. So luckily, as Joe has said, there's been tons that have gone on in public health in this area. And over the last 9 months, the hospital has done a lot. We have created more testing. We've converted the MGH Health Center into a RIC. We've conducted over 21,000 COVID tests since April. We distributed close to 100,000 care kits right now to MGH Health Centers and community partners, made up of masks, information materials, sanitizer. We increased our communication efforts and outreach, producing flyers, videos, and materials from kind of trusted sources. We had a volunteer workforce that reached over 5,000 Chelsea residents alone to educate and connect them to resources. And lastly, to serve the respond to the overcrowding in Chelsea and Revere. The cities of Chelsea and Revere partnered with the MGH to open an isolation hotel where 153 patients were ultimately served. So the need to really sustain this work is needed now more than ever. With the vaccine arriving any day, we must work to break down the myths and distrust. We have to help communities become active participants in their healthcare and work on the root causes of poor health, lack of living wage jobs, wealth building, affordable housing, education, to help communities thrive. So I am thankful for being part of this event, and really want to thank Fiona for inviting me here today, and want you to know that we are committed at the center and at the hospital for not just celebrating this work now, but celebrating this work always. It's important.
Leslie, thank you so much. Really appreciate it. Next, I'm pleased to introduce Dr. Sarah Kimball, who's the co-director for the Boston Medical Center Immigrant and Refugee Health Center.
Thanks so much, Fiona. Does my sound okay? Great. So I'm just totally thrilled to be here celebrating today with so many collaborators. And I think what's particularly notable to me is how many different organizations and institutions are showing up here today to celebrate the vibrancy, the diversity, the richness of the Boston community. And just for me, it feels particularly notable that we all have the same goal, that we all want to make Boston and the surrounding neighborhoods a place where our immigrant friends and neighbors and colleagues can thrive. And this is in the context of coronavirus, as my colleagues have mentioned. It fiercely reminded us that equity and justice have to matter to all of us, because when we ignore or we discriminate against our people in our community, we are only as strong as our most vulnerable members. And so I'm here today with, both I think the heaviness of the last year, but also with a sense of celebration that there are so many people in Boston who are committed to eliminating the disparities that our immigrant patients, colleagues, and neighbors face. At BMC, just like was mentioned at MGH, we've seen in both heartbreaking and really tremendous detail the ways that people's immigration status and their history has rippled through their disparities and their vulnerabilities during the COVID-19 pandemic. I'm a primary care doctor, so in my clinic every day I'm hearing stories about how people have been exposed or infected, lost their jobs or worse, or even family members. And my patients are worried about a broad range of things. They're worried about housing and eviction. They're worried about their safety from coronavirus. But they're also right now worried about whether they've come to a country that wants them. And I think that's been one of the most painful things over the last 4 years, is hearing people say, I came to this country because I thought I would be safe and welcomed, and that's not what I'm feeling, and that's not what I'm seeing. So at BMC, one of the things that we have been focusing on in our Immigrant and Refugee Health Center is really extending what we think of as our scope of work. And like many of our colleagues, we've realized that we can't just focus on people's blood pressure if they're worried about being deported. And so we have embedded immigration legal services. And one of our pilots during this pandemic has actually been to add public benefits representation, because we know that our immigrant patients have been some of the most affected by COVID. And so we know that they're in need of more benefits, but the effect of public charge has made it hard for them to know what they can safely access. So some of the pilots that we're doing is by really creating an interdisciplinary team to try and address some of the needs that we've seen come up in our patient populations. We're also over the next year investing in our career services program, which is something that has been really a flagship of particularly one of our programs, the Boston Center for Refugee Health and Human Rights. They have for really kind of led the way, I think, in thinking about how people's employment and their meaning that they get from it, but also their ability to take care of themselves and their families is driven by their ability to find meaningful and work that pays them well enough to have a living wage. So we're investing in expanding our career services program. So I would say, just to be very brief, you know, in our center, we really believe that your immigration status doesn't have to determine, and it shouldn't determine, how healthy you are. But unfortunately, that's not the world we live in. And we know that health disparities do exist for immigrants in our communities. And they exist in large part because of the political decisions that we've made. You know, we've chosen as a society who we give access to services like health insurance, food, nutrition, safe places to live. And so we really, I think it's, have some hope, but also feel like it's a moment where we need to really think about how we as a city, as a state, as a country and a nation, you know, how we decide to undo these disparities. We have to learn to build political will together. We have to invest in newly arrived migrant individuals in our community, the same way we would want to be supported if we were to have a crisis or a turn in our luck and we were to need to rely on others to support us. So I'm just so excited to be here today because I think this kind of coalition is exactly what it's going to take to really move forward in a world where I think many of us are hopeful that there's a possibility for a much more progressive, expansive, justice-based approach to immigrant rights and health. And so, like I said, I'm just so thrilled to be here with so many people who I know are like-minded and pushing for that agenda. Thank you so much.
Thank you so much, Sarah, for those comments. Next, we have a colleague from across town, Dr. Julia Kohler from the Division of Infectious Diseases at Boston Children's Hospital.
Thank you so much, Fiona, for having me, dear Jason, other panelists, participants. First, I really want to congratulate you on founding this amazing center at MGH that highlights the importance of our immigrant families, our immigrant neighbors, patients. I think it's going to make a big difference in the care and health of our immigrant patient families. And really thank you for caring, for showing and highlighting care for these families who we know are the ones that have kept us fed and cared for and housed before the pandemic and during it. So as we are talking about, these are the families that have been most impacted, disproportionately impacted by infection, illness, and death from COVID. And so I think this is the moment where your event highlights our moral and practical imperative to lift up their voices, care for them better, prioritize them for interventions to diminish infections and indirect harm from the pandemic, like hunger and evictions. I'm a pediatric infectious disease specialist at Boston Children's Hospital, and as you might know, my institution began admitting all pediatric patients that needed to be hospitalized in our area during the spring peak of the pandemic so that other hospitals like MGH, BMC, Cambridge Hospital, Tufts could optimize their inpatient and ICU capacity for the adults whose COVID courses are typically so much more severe than those of children. So we did see many children with SARS-CoV-2 infection. As of 3 days ago, there have been 722 patients diagnosed with COVID at Children's Hospital, and 54 patients were admitted with multisystem inflammatory syndrome of children. I actually remember being on service when the second patient who came in with multisystem inflammatory syndrome of children, MISC, was admitted. We thought he had myocarditis. We thought maybe Coxsackie virus. And then the PCR for COVID came back, or for SARS-CoV-2 came back positive, not typical, by the way. And it was only a brilliant cardiology intensivist who said, oh, we had a patient like him last week, and we did this, this, and this, who kind of diagnosed MISC in him before that entity had ever been described. So I can say we have not studied this formally, but anecdotally, I can say that the children with COVID in Boston come from the same communities as the adults. And that's obviously intuitive because respiratory viruses spread in the home. A CDC study from the beginning of the pandemic through July 31st of the children who died of COVID, where they had captured 121 children, showed that 78% of these children were Latino, Black, and Native American, and the proportion of children dying from COVID was double that of children of these groups in the population. I was especially shocked to read that 32% of these children did not die in the hospital. They died at home or they died in the ER, reflecting the vastly insufficient medical care that these families receive. And so this brings me to the conditions that place immigrant and Black families, and of note, these are often the same families, at such high risk of COVID infection. And these are things that we can do something about legislatively, because here in Massachusetts, we are much worse at protecting our immigrant families than other states. So we don't protect families from immigration and customs enforcement from ICE. We fail to protect them in the workplace. We have terrible crowding due to high rents, and we have let our eviction moratorium expire. And as Al Gore wrote recently in the New York Times, we need to deal forthrightly with our shortcomings instead of touting our strengths if we want to make progress here. So I would say all of us going forward need to think where we can focus our energies so that systemically these children and these families are not continued at this high risk of infection and death from COVID. Workplace safety enforcement, the Safe Communities Act, the Safe Driving Act, Housing Security Bill, anyway, there's a bill that was not passed. The wage theft protection bill, because why did immigrant families become hungry like 2 weeks into the COVID pandemic? They are the most targeted victims of wage theft, and wage theft protection is a very low priority in our state. So just leaving you with these thoughts, please, there are things we can do. We have to focus our energies better. We have to provide better access to testing and to vaccines. We are 10th in the testing disparities of 48 cities studied over the summer. These disparities are currently happening and there are things we can do about them, as Al Gore is saying, beyond celebrating our achievements. Thank you so much.
Thank you, Julia. We'll now turn to just north of the river with Dr. Lara Germanis from Cambridge Health Alliance.
Thank you, Fiona, and thank you for putting together this fantastic week of events and for including me on this panel with so many wonderful collaborators. It's just so important to be bringing light to the importance of the role of immigrants in our society and to kind of push back against this xenophobic narrative of immigrants as a drain on our society, because in reality, immigrants are the bedrock of both our society and our economy. And when we use these words like essential workers or frontline workers, or what we have to recognize is that these people are really the foundation of our economy, and they're out there trying to make sure that they can put food on the table and working jobs that they don't have a choice in many cases not to go to. And we'll be hearing more about that from folks like from the MIRA Coalition and Chelsea Collaborative. So I'll be really brief. At CHA, just as a point of information, we actually have a large immigrant population that we see, and many of that population are also Brazilian. But in particular, our hospital floors and our clinics were packed with people from Central America. So, sort of disproportionately, even more so than they are represented in our patient population, is one particular thing that we've seen in this pandemic. So I would just echo, though, what Julia and Sarah and others have been saying, just about the importance of recognizing that, if we have learned one thing by the end of this pandemic, COVID has demonstrated the way that inequality impacts health. But what that also means is that we as doctors, our purview does not end within the walls of our institutions. And while, I am so grateful, and CHA joins institutions like Mass General in focusing on the social determinants of health, trying to make sure that people, focusing on food security, making sure that families have access to food when we're in the process of diagnosing and assessing their level of illness. And joins, BMT in focusing on a lot of these really important social determinants, and thinking about housing and places for people to isolate. But we also have to remember that decades of anti-immigrant policy and, on behalf of both Democratic and Republican leaders, that we, in Massachusetts, we have not had a great track record in making immigrants feel at home. In the state of Connecticut, immigrants can obtain a license regardless of their documentation status. We need to be thinking about how are we going to be supporting immigrants more broadly, because when they feel welcomed by our society as a whole, they're going to be more likely to access testing and treatment and the other services that are available to them. And so I would just urge, I think it's really wonderful that the Mass General Chelsea Clinic, joined the coalition of supporters for the Safe Communities Act, thanks to the important work of Fiona and many others on this panel and at your institutions. And we need to be thinking more broadly about policy changes like the Safe Communities Act, like the Working Families Mobility Act for getting people driver's licenses, and like the Housing Stability Act. You can't shelter in place if you don't have shelter. And so we really need to be thinking about how are we thinking about the whole broader picture to make sure that immigrants really do feel that our society acknowledges that migration is beautiful and that they are the bedrock of our society. Thank you so much.
Thank you, Laura. Next up, we're excited to have Joel Rivera, a senior campaign organizer from the Massachusetts Immigrant and Refugee Advocacy Coalition.
Thank you, Fiona. Hi, everybody. Joel here with Mira, he and El. Thank you so much for having me today. 5 minutes is short, but you've all done a great job of being brief, and so I will do my best to do the same. Let me share my screen. So hopefully everybody can see my screen now. I'm going to do my best to cover this amazing work that was done in under 5 minutes now. I'm going to highlight a few slides, and then I will share the link to this with Fiona so that it can be sent out afterward for anybody that wants to do a deeper dive. A lot has been discussed generally about the impact of COVID on people, but not in particular on an immigrant community service. So that's something that a failure that we saw, and something that we sought to treat, right? And so we did one community survey in July that was amazing. We were able to translate it and get responses in English, Spanish, Portuguese, Haitian Creole, French, simplified Chinese, Vietnamese, and 9 other Asian languages. So special shout out to all of our members who not only helped us find respondents, also helped us craft the survey and helped us translate it. So we had help from the Brazilian Women's Group and the Brazilian Worker Center in translation. Asian Asian Task Force Against Domestic Violence was extremely helpful there as well. Over 400 responses, 150 households, including undocumented members, which is amazing. And as you know, so hard to reach our communities, and we're able to do that through our connections with community partners like the Chelsea Collaborative, who's right here and who's going right after me. So hi Gladys, it's so good to see you, and we love you and all the work that y'all do. So special shout out to our members, of course. Our coalition is only as strong as our membership, and we really can't do anything without them. Okay, I'll leave the wonky stuff to folks to dive into later, but I want to skip to slide 11 here. Sorry, my computer's a little slow. I want to focus in particular today on access to medical care, access to food, and access to housing, which we know everyone is struggling with, but in particular immigrant communities, and in particular undocumented communities. So we see here that about 40% of households who had family members get sick did not seek testing and treatment, which we know is a major shortcoming, and not how we deal with the pandemic, right? We want equitable access to testing and treatment for all of our community members, and we see that that's not how it's playing out in practice. I like to talk about when we were doing census work. This is tangentially related. You know, we always sought to communicate to our volunteers the juxtaposition of certain communities, right? Like Charlestown versus Chelsea, or like Chestnut Hill versus Chelsea, right? In like April, Chestnut Hill was already responding to the census at like 88%, whereas Chelsea was at like 30 or 40%. And so you have a community like Chelsea, densely populated, high immigrant, high undocumented immigrant, high Spanish speaking and POC population, chronically underfunded, doesn't have the access to resources they need. Pair that with a really high percentage of essential workers and folks at risk of getting sick, and you have folks in the red zone, just like Everett and a lot of those other gateway immigrant communities that are so immigrant rich and wonderful, but also have been hard to hit by the pandemic. Oh no. Does everyone see my little pinwheel? Or is that just on my side? Okay, I apologize. My computer's being a little slow right now. Oh no, it's embarrassing. My Wi-Fi's terrible. Okay. All right, are we good again? Sorry, I froze a little bit on my side.
You're good.
You're moving forward.
Okay, thank you. So I wanted to highlight on this slide that a lot of folks didn't get tested even though they were sick, because they felt they wouldn't. They tried and got turned away, or they didn't try because they thought they would get turned away because they weren't sick enough, which we definitely don't want to see. This slide shows something similar. Okay, I think I have a couple minutes left. I want to jump to housing and food insecurity, and then to get into our key takeaways. I know we're running out of time here. So as we saw, I mean, there's lots of social determinants of health, which I think is a wonderful framing for healthcare, and I think a lot of you share that, which is why I love being in this space. So a lot of people, almost 50% of our respondents were behind on rent. So it wasn't always for the folks that we're talking about that they were missing mortgage payments or that they had already been kicked out of their housing, but they were in a they were on the road to homelessness and losing housing, which we think is a major issue. And then about food, it was impressive to me to see that almost a third of our students were getting food from community groups and food pantries. So as is often the case, the federal government, the state government, even local governments were failing to meet the need of community members. And so community groups, formal or informal, were stepping in to meet that need. That's something that I think is so amazing to see in general, but especially to have seen during this pandemic for folks to step up. And then so the key takeaways, obviously everybody is struggling. It is a pandemic. This has been a really hard time, but we think in particular, the folks that we work with, immigrants, are struggling because not only are they essential workers, but they are also not eligible for safety net programs at any level of government. And so we think that both the state and federal government should be responding, indiscriminately by, at the national level, passing something like the HEROES Act, making sure that things like public charge don't go into effect and any rule changes that adversely harm communities. And then at the state level, we actually did this. This is awesome. So we boosted RAF to 50 million. That passed in the budget like a week or two. So that's amazing. That's not as much as we need, but I think it is an improvement on the 20 million from last year. So that's huge. So folks can have access to that. More money for community organizations to be the ones who disseminate that to our most vulnerable communities. And then as prior folks have said in this meeting, passing the Safe Communities Act, the Driver's License Bill, emergency paid sick time, and Housing Stability Acts would all be a good place to start to make our community members feel more safe. And so I'll end with just a thank you again to a lot of the wonderful organizations that we were able to work with this year.
Thank you so much, Joel. Really appreciate you sharing that data with us. Next up, I'm thrilled to introduce the inimitable Gladys Vega from Diva. I don't know how she found the time to be here, but we're very grateful. Gladys, I think you're on mute.
I am Gladys Vega, and I'm so grateful to hear all these presenters and everything you guys are saying, with the exception of not having immigration policy stick to my ears, in terms of this center, in terms of making sure that we continue to worry about access to medical and access to healthcare services for members of our community. I feel that there's so much being said, and then as I'm thinking of our members, I think of this one doesn't have, health insurance. This one still thinks that if they apply to WIC, they will be in some type of risk with INS or ICE, and that tremendously worries me. I think that I gotta tell you guys that in terms of the group that I'm presenting to, which is you all right now, I continue to be extremely worried about our families. I continue to feel that although immigrants in the Commonwealth of Massachusetts has so many contributions, we are still like doing Band-Aid work in terms of the need necessary in order for us to meet all their needs. I feel that the 4 case workers that I have working in housing, they're not even close to addressing the needs of the people in terms of eviction and preventing eviction and helping them with RAF. I feel like the lady that we talked on Thursday that came here after having surgery at MGH, who basically said, I just came from selling pawning my jewelry because I owed $1,600 rent and I'm not able to apply for RAF because that's not a huge amount of money. And I hear that in order for me to apply for some of the services, that you have to owe more than $10,000. And I'm like, no, that information is incorrect, but we'll be able to help you with whatever issue you have. So I think that as we think about how else we can help our community residents, I would ask that we continue to to make them feel welcome, but at the same time, repeat the services that we're providing. That just because a person tells you, I have health insurance, doesn't really mean that they do. And it may be that many other members of their family do not have health access to health care because they're afraid to tell you that they're undocumented. So I feel that I hammer this to our case managers when we have the full line and they're going with their iPads to check in and do the wellness check, because people are still very reluctant to provide information. We don't ask for information, but we just want to do a wellness check on how else can we help you. Do you have health insurance? Does anyone in the mom line every Wednesday, we ask, do you have WIC? Is the program WIC sustaining you enough with voucher that you have enough for the rest of the month? And all those questions we constantly ask them, because once you engage on that conversation, you then get more information that what you were supposed to, that what they were giving you. So I think that the second phase, listen, there's a lot of people in that MGH, not MGH line, but in the Chelsea City Hall line where all our hospitals are contributing to testing, but there's many people that have the symptoms that are staying home and not getting that test. And I cannot assure you the fatigue that people are feeling in terms of not wanting to have anything to do with COVID-19. And that is very scary for me, because when you begin to shut down in this idea that, COVID-19 is just the flu, or COVID-19, I'm already sick and tired of it, of the restrictions and stuff, then we're not contributing to the end of the pandemic. So I honestly think that we have to continue to bring fear in terms of, listen, the only way we're going to be able to that, so you need to protect yourself and protect others. Because I really think that when we talk to people, and when I have people that have all the symptoms and they're like, oh no, that line is too big, I'd rather not be tested. I'm like, but you're living with other people. Aren't you afraid that your family member would be the stage 4 person that you have living with you? They have in this particular case that I was convincing the woman to get the test, the grandma is 4-stage cancer positive, and she didn't want to go and make the line for testing. And I said, you have to, because you're saying that you're coughing, that you have a temperature, you shouldn't be even in the Chelsea Collaborative. If anything, take your time to go to the line or go call your regular doctors. So I think that I cannot highlight enough the fear that I have for people that are feeling fatigued, that are not taking care of themselves. The fact that they may not want to use the vaccination when it gets available, because they feel that it's not long enough in the market in order for them. These are questions that we have asked in the line of food. And one of the case managers reported that when they were asked that question, they're like, why are we going to try that vaccination if that has not been tested for so many people and has only going to be in the market by us, and we're going to be their guinea pigs? And I'm saying, because we don't have anything else, and if this is a life or death situation, if that's what it takes, we will do the test. But we have to not only do the test, but get the vaccination. So I urge you to continue to do the care kits, to get people in the healthcare programs so that everyone is insured. I encourage people always to do the flu shot, because I got COVID-19 in November 7th, and I think it made a big difference for me, because I had done the flu shot a month, I think it was a month before. So I encourage people to also do the flu shot. So I think that those things that we probably tire, and you as healthcare providers, that you're constantly telling your patients to tell, please do not give up, because our community sometimes listens more to their neighbor or to the news. So I encourage you to be a little bit pushy with our community as if they read something like, do not trust the vaccine because it's not really being tested in a lot of people. They may believe that for now, so please, do the vaccination. So I encourage, please Let's not rely on, I had a conversation with my patient a month ago. Let's completely repeat those things, because I feel that as a person who has been out in the community since March 5th, that our community residents are getting that little fatigue that we cannot accept, especially in a COVID-19 era. Thank you.
Thank you so much, Gladys, for that important community perspective. Next up, we have Yusufi Vali, who is the director of the Mayor's Office for Immigrant Advancement in the city of Boston.
Thanks so much, Dr. Fiona, and Gladys. Always enlightening to hear from you. And thank you really on behalf of the mayor to all of the providers, the heads of different hospitals and immigrant kind of task forces and centers for being on this call and for this important conversation. I'm the director for the Mayor's Office for Immigrant Advancement, and the conversation here today is very near and dear to my heart because I'm an immigrant myself, immigrated when I was 9 years old to America, and my parents were 44 and 40, and so particularly in those lines, those testing lines, in the faces of so many of our immigrants, I just feel like I'm seeing my parents right there. I want you all to just consider my office, the Mayor's Office for Immigrant Advancement, as real partners in this work with you. Our office mission is to be an advocate in city government for our immigrant residents to thrive civically, economically, culturally, and socially. And to be strong advocates for our immigrants, my office needs eyes and ears everywhere. And I'd like to ask you all to be our eyes and ears in the health system. If you see your immigrant patients struggling with a particular need, contact my office and let us know. If you see a program, policy, or service that you think ought to be implemented to benefit our immigrant residents, let us know. If you see a program, policy, or service in another city that you think ought to be implemented here in Boston, let us know. And just to give you an example of this, some of us recently met actually a doctor from MGH, Dr. Altaf Sadi, who'd done research on immigrants, and she had a list of 10 recommendations that a number of community health clinics and hospitals should begin to adopt. And we took that work and shared it with the Boston Public Health Commission, which is now sharing it with a number of community health clinics across Boston. So that's how you can use our office. Now, there's no doubt inequities exist, and many of you have spoken very eloquently about those inequities, and so I won't spend more time on them. But what I do want to say is that it is difficult and dogged work to remove the inequitable ghosts of the past in many of our systems. And again, please know that you have real allies in this work with Mayor Walsh, my team, and myself. That's why the mayor created the Cabinet of Equity recently and brought Dr. Carolyn Crockett on into the team. And we're taking an equity lens with everything that we're doing in city government. My department sits within the equity cabinet. It's going to be a tough winter. COVID rates are going up, as Gladys so eloquently, spoke and heartbreakingly spoke. It's going to be a really tough winter for our immigrant communities. There is also a lot of distrust in the vaccine, and so we need your help. This work is so important, and just know that again, the city is going to be, Mayor Walsh and our whole team is going to just be working hard day and night to make sure that our residents get the proper information that they need and are able to really, hopefully, once the vaccine is placed, begin a recovery process. As I sign off, I do have an ask from you all. I think our health system's real strength is that it is a very diverse system. And what I would love is if there were a way that you could come up with a potential list of doctors from different immigrant backgrounds who could really speak to the vaccine. My office is going to be working with a number of our community partners to do webinars in different communities. And there's nothing like a doctor from your own community or a practitioner from your own community who can speak and hear the concerns around the vaccine and answer them in a clear, transparent, honest way, and also really encourage people to take the vaccine. And one of the things that we're hoping is that at the city that we can get some of these doctors to actually videotape themselves while taking the vaccine, to encourage our immigrant residents to also hopefully take the vaccine if it's safe for them. With that, thank you so much for your work. If any of you are willing to take a lead on such a list, or Dr. Fiona or any of the other immigrant centers, please email my office. Luigi Lalonde, who's my colleague on this call, will put in our office's information. You can email all of us at immigrangadvancement@boston.gov. And again, please know you have a partnership and a real advocate here in the city for the work that you're doing. Thank you so much.
Thank you so much, Yusufi, and we'll definitely amplify that call. Now we have Dr. Matt Gartland, who's the director of the MGH Asylum Clinic.
Thanks, Fiona. I'll be brief to try and get us in under the wire here. I just want to say thank you for the tone of this kickoff. I think it's both a celebration, but also a call to action. And I know this group has been working hard for the last 8 months and really long before that. And I briefly want to just call attention to a group that we haven't talked about, which is those individuals in immigration detention. And certainly that extends to other individuals who have been targeted or felt targeted by immigration enforcement activity. So since the pandemic began, about 5,400 people in ICE detention nationally were diagnosed with COVID as of the latest numbers in the end of August. And really that calls out two things. The first thing is that people in detention were 13 times more likely to get COVID than somebody in the average population across the US. And that was work that was really publicized by a group of HMS medical students and faculty members. But secondly, the transparency around detention has just been terrible. We really don't know what's going on. And so I think this is an opportunity for us to act as experts. At the Asylum Clinic, we've participated in 2 sets of lawsuits. One is the Savino lawsuit, which involves Bristol County House of Corrections. In the spring, we gave expert testimony that contributed to the judge ordering the release of about 50 people from ICE detention in Bristol. Of course, as they de-densified the population there are still people that remain in custody. The second thing we participated in is the Flores Settlement Agreement has ongoing litigation, which governs the detention of families and children in particular. And so we're really calling attention to the fact that there are families in 3 facilities around the country who are being held continually. And the prospect of child separation, as they call for children to be released, but not for family members to be released, is still with us, unfortunately. The call to action for us is to continue to be loud voices advocating for individuals in detention. So thank you very much for inviting me today.
Thank you so much, Matt. So I know that it's after 1 o'clock and that some people may have to jump off, but before we close, we did want to briefly introduce everybody to the new MGH Center for Immigrant Health. And Amu, if you can go ahead and put the slides back up, that would be great. So this is a project that's been in the works for more than a year, and we're really excited to finally officially launch. This is a new virtual center at MGH, which is designed to foster excellence in clinical care, education, advocacy, and research aimed at improving the health and well-being of immigrants. And our programming is based upon 6 basic pillars, which will be rolling out in phases. The first and I think most crucial right now is developing resources and providing navigation to those resources, as Gladys and others have so eloquently described. So we do actually have an immigrant health resource specialist who is available in our paging directory. For those at MGH, you can go into the main directory, and under the drop-down menu, it says Immigration Resource Consult. anytime you have a situation where an immigrant patient is having trouble accessing a resource that they need because of their immigration status, or has questions about public charge, or has any other concerns related to their status, you can page this specialist, and she will help you navigate those questions. We are also working on expanding a medical legal partnership inspired by the great work over at Boston Medical Center, so that we can address some of the major stressors that our immigrant patients are experiencing, especially in the context of all of the legal changes that have gone on in the past few years. As things move forward, we're hoping to develop some mental health and nutrition programming. We are hoping to become a focal point for education and advocacy around immigrant health issues at MGH and beyond. We're very engaged in inclusivity work, including this week's Migration is Beautiful campaign, and we're always looking for opportunities to inform our advocacy with quality improvement and research work. So we have a website, which I think Amu has put into the chat. Please feel free to check it out. And if you have any suggestions or thoughts about collaborations, please reach out. We're very excited to engage in this work and want to make sure that it's meeting everybody's needs. Next slide. Great. So now I'll just quickly close by telling you about the other amazing events that we have coming up this week. I'm so excited about these. Starting tonight at 7 p.m., we have a screening of The Last Dream, which is a documentary about temporary protected status. It's actually was put together by children of people who have TPS, describing their fears of what could happen if their parents lose that status. They've taken this play up and down the East Coast, including performing it before Congress. And tonight at the screening, some of the actors, the children you see here, will be available to participate in question and answer, as will the directors. So please join us for that. Next slide, please. Tomorrow at noon, we have a great co-presentation by the MGH Coalition, 32 BJ SEIU, Service Employees International Union, and Healthcare for All, talking about some of the legislation that Dr. Kohler and others referenced, and how we here in Massachusetts can advocate for bills that will help our immigrant patients and family members and colleagues. And then at 7 o'clock tomorrow night, the MGHFC, or Mass General for Children, Diversity and Equity Group, will be hosting an anti-racism book club, which they do every month, but this month's book is Notes from an Undocumented Citizen by Jose Antonio Vargas. It's a great book, a quick read if anybody hasn't read it yet and would like to join us. And I will just point out that registration in advance is required. Next slide, please. On Wednesday, we have a really exciting presentation at noon by the Pre-Health Dreamers, a group of medical students and others who have DACA status and are looking to work in the healthcare field. They'll be providing us with an Undocu Ally training. And we'll also be joined by a resident here at MGH who is a former DACA recipient. So we'll get to hear multiple perspectives on that experience. At 7 o'clock on Wednesday night, there will be a Know Your Rights training led by Lawyers for Civil Rights. So if you have patients, family members, friends, colleagues, anybody who has questions about their legal rights because of their immigration status, we would definitely encourage you to share this link with them, and there will be Spanish translation available. The next slide, please. On Thursday at noon, we have a presentation by Drs. Lanre Falusi and Anissa Ibrahim, who are two pediatricians from the American Academy of Pediatrics, who will be speaking about how to effectively communicate and advocate for immigrant families. I've seen this presentation before at the AAP National Conference this year. It's phenomenal, so definitely encourage people to check that out. And then finally, on Friday, December 18th, which is the United Nations International Migrants Day, we will be hearing from Dr. Altaf Sadi, whose research Yusufi Valley referenced. And she'll be speaking about her research on how to create immigrant-friendly healthcare systems. She'll be joined by Dr. Kimball from BMC, speaking some more about how their center has implemented some of these practices. We'll also talk a little bit about how we're hoping to implement them here at MGH. So for those who are in the MGH vicinity, there is this beautiful installation of giant butterfly wings out on the Bullfinch lawn, and they're there for you to take selfies with if you would like and to share on your social media. Stop by anytime, they'll be there all week. And then hopefully we'll be having this installation travel around to other MGH health centers and locations in the future. Next slide. You can also, if you're at MGH, go onto the Apollo website, which is linked with that code there, and download Zoom backgrounds and profile stickers to show your support for the Migration is Beautiful campaign. Next slide. And lastly, a huge thank you to all of the organizations, departments, programs here at MGH and across the greater Boston area who have signed on to co-sponsor this event. We really hope to demonstrate that the entire medical community here in the Boston area is here to support our immigrant patients, that nobody should be afraid to seek care for COVID-19. And once COVID-19 is behind us, which hopefully won't be too much longer, we will still be here and we still want to serve this population. So thank you again to everybody who's joined us in spreading that message. And with that, we'll close a little bit late, but I'm so grateful to all of you for joining this kickoff event, and please join us throughout the week for the other events as well. Thank you.